Hi all, we are here in Venice, Mestre, today for the conference about aniridia net cost action. The last meeting of this project that will present all the results from the discussions in the groups of the cost action dedicated to this rare disease of the eye. In this moment we are together with Fancisco Figueiredo, who is a professor of ophthalmology at Newcastle University. Thanks for being with us.
My pleasure, thank you.
So, Professor Figueiredo, today you presented the study about AAK transplantation. What are the main results in these studies, and how is important for the treatments of aniridia?
Right, I mean, these studies we are still finishing analyzing the data, and there is still some more data to collect, as I said in my presentation here. The main purpose of this study was exactly to look at the outcome of corneal transplantation patients with aniridia, and then the preliminary suggestion is that the survival rate for 1 year is around 71%, the survival rate for 2 years is around 62%, but we need to get longer data to see, because obviously the main concern is that these patients have limbal stem cell problems, and then the corneal transplantation doesn't address that, and then to see if this is going to prove that if the corneal transplantation for patient with aniridia should be done as a primary procedure or should be done after you fix the stem cell problem, because the survival rate long term for the graft may not be as good as a primary graft for somebody who has lower risk, no aniridia. And it's important as well that you have to take into consideration several factors, including the fact that the people with aniridia can have other eye problems, not just purely just the corneal problem. It's very common that they have glaucoma, they have problem with the retina in the back of the eye, they're born with macular problem, in a way that you need to put in context, because most of the patients that present here have very poor sight from the very beginning, and then the improvement of sight sometimes is not significant because of these other problems as well that's present in this patient. Then a proper assessment of the patient is very important.
So usually the surgery about the people with aniridia is something really hard to manage also after the we can say the operation. But what are the challenges and opportunities coming from an aniridia associated keratopathy transplantation?
Well, I mean, one of the critical things is when you are on this early stage of aniridia keratopathy, it's very important to try to do your best possible management, because, for example, we know that patients with aniridia, they have all the problems with the cornea. The corneal sensation is reduced because the corneal nerve is impaired. All the faults with the genes that the cells don't adhere so well between themselves. And then medical management at the early stage is really, really important. Artificial tears, always use preservative-free medication, because the preservative can upset the cornea as well. Use corticosteroid drops to control the inflammation, because these corneas are always very inflamed, and the inflammation makes it worse. That's like a vicious circle, that if you don't treat the inflammation, if you don't treat the dryness of the eye, if you don't make sure you preserve the sensation of the eye, all these things together will make the condition progress. And then that's what I'm saying, that a good assessment to start with and a good management, early management, is very important.
And so, according to the results from your study, the benefits of the transplantation could decrease during the years after the transplantation. So what could be the good next steps in order to improve this kind of opportunity for aniridia?
Right. It is very important, because like I showed in my data, most of the patients with aniridia keratopathy, they already have poor vision. The majority of them already have like either counting finger vision or even worse than counting fingers. And then you need to do your best to see, that's what we're trying to see the result here, that we don't know the full result because we're still doing analysis and still get more data to collect, is that the transplant itself is going to be beneficial in the sense that it's going to help restore some sight to the patient. And that's what we need to do, because our data is still very short follow-up, 1 year, 2 years, and we need to see if we can get more years, longer data to prove to ourselves that the transplantation of the cornea at this stage is going to be beneficial. Because there are some data showing that if you restore the stem cell function first before you consider doing a corneal transplantation, you could have a better result. But the problems we have is that data is still very limited, not necessarily in UK, worldwide. And then we have to have a little bit more the full picture, and then possibly try to get together. There are some registries in the world, then try to get data together in a way that we may have a better definition of what's the best outcome and what's the best procedure to do on this stage of the patient.
Thank you for your spotlight on this.
Thank you very much. It was a pleasure to talk to you. Thank you.